Acute myeloid leukemia, AML. Acute myeloid leukemia, AML, is a blood cancer that appears suddenly and grows quickly. It starts when immature white blood cells called blasts become cancerous. These abnormal blast cells are known as leukemia cells. They multiply quickly and continue to divide but never mature into normal cells. Because the leukemia cells are immature and abnormal, they don't carry out the usual infection-fighting role of white blood cells. They also crowd out normal white blood cells, which then can't work properly. This increases the risk of infections. When the bone marrow fills with leukemia cells, there is little room for normal red blood cells and platelets. This can cause fatigue, bleeding problems and other health issues. What is the difference between acute and chronic leukemia? While all types of leukemia start in the bone marrow and affect white blood cell production, they are grouped according to which type of white blood cell is affected, whether there are abnormalities in the bone marrow, and how quickly the disease develops. Acute leukemia usually affects undeveloped cells, occurs suddenly and grows quickly. Chronic leukemia usually affects partly developed cells, appears gradually and grows slowly over months to years. For more on this, see chronic leukemia, Chia, or chronic leukemia CML. There are two types of acute leukemia. Acute myeloid leukemia, AML, acute lymphoblastic leukemia, ALL. What is the difference between AML and ALL? AML and ALL are the two main types of acute leukemia. The difference between them is the type of white blood cell affected. Acute myeloid leukemia, AML, develops from myeloid cells. There are different subtypes of AML, including a subtype known as acute promyelocytic leukemia, APML, that develops from immature myeloid cells called promyelocytes. APML is treated differently. Acute lymphoblastic leukemia, ALL can develop from different types of lymphocytes, including B cells or T cells. See more on how ALL is diagnosed and treated. How leukemia starts. The bone marrow produces three main types of blood cells: white cells, red cells and platelets. Leukemia starts when abnormal white blood cells become cancerous and crowd the bone marrow before moving into the bloodstream. Without treatment, they can spread to lymph nodes and some organs. What causes AML? The exact causes of acute leukemia are not yet understood. Things known to increase the chance of developing the disease include previous treatment with chemotherapy or radiation therapy, having certain genetic disorders, such as Down syndrome, exposure to high levels of radiation, e.g. nuclear accident, exposure to some chemicals, such as benzene, smoking, obesity, particular blood disorders, such as myelodysplasia, for AML, some viruses, such as Epstein-Barr virus, for ALL. Who gets AML? Each year in Australia, more than 3,700 people are diagnosed with a form of leukemia, and it is the most common type of cancer diagnosed in people under 24. About 1,400 of these cases are acute leukemia, accounting for about 1.1% of cancer cases in Australia, so overall, acute leukemia is rare. About 1,100 people are diagnosed with acute myeloid leukemia, AML, each year. AML becomes more common with age and mostly occurs after 65. The blood is pumped around your body to provide oxygen and nutrients to your tissues, and to remove waste products. It is made up of blood cells carried in a clear fluid called plasma. All blood cells live for a limited time and need to be continually replaced. Most are made in the bone marrow, which is the spongy part in the center of the bones. Bone marrow contains blood stem cells. These are unspecialized cells that usually grow into one of the three main types of blood cells: red blood cells, white blood cells or platelets. Each type of blood cell has a specific job to do. Blood cells. There are two families of blood stem cells. Lymphoid stem cells develop into white blood cells called lymphocytes, which are an important part of the immune system. Myeloid stem cells develop into red blood cells, platelets, and all white cells apart from lymphocytes. When myeloid white blood cells grow abnormally, this is called acute myeloid leukemia, and when lymphoid white blood cells grow abnormally, this is called acute lymphoblastic leukemia. What is the lymphatic system? The lymphatic system is part of the immune system, which protects the body against disease and infection. It is a network of vessels, tissues and organs. Lymph vessels. These thin tubes are found throughout the body. They carry lymph fluid. Lymph fluid. This clear fluid travels to and from the tissues in the body, carrying nutrients and taking away bacteria, viruses, abnormal cells and cell debris. Lymph nodes. These are small structures in the neck, underarms, chest, abdomen and groin. They filter toxins, help fight infections, and produce some blood cells. Spleen. This is an organ in the abdomen. It clears out old or damaged blood cells.